What are we seeing from our members?
Sharon, what kind of issues are we seeing around antimicrobial stewardship?
Well, Paul, that's a good question. Actually, common infections are becoming deadly threats because of the increasing number of pathogens that no longer respond to the antibiotics that were designed to kill them.
Inadequate cleaning of flexible endoscopes before disinfection.
The issue is that they clean the scopes normally, but because of the scope design and particularly the elevator channels and the RCP scopes, even if we clean them correctly, they're still not being cleaned to the level that they could be being cleaned, basically because of the scope design.
Unintentionally retained objects despite correct count.
And the problem with this is they're often not diagnosed to a significant amount of time after a patient has left the operating room. And there have been known cases where it wasn't discovered till 6.5 years later. And the problem with this is there's disastrous outcomes for patients. Retained items have led to death, they've led to sepsis, perforations, and a host of other outcomes that we don't want to see in our surgical patients.
Why is this issue important? Health IT configurations and organizational workflow that do not support each other.
We need to provide safe and effective care. So communication is a big part of what we do within the health IT system. So we need to make sure that we're communicating information and that we have that information in a timely fashion.
Inadequate management of behavioral health issues in non-behavioral health settings.
It's an issue that's becoming more and more prevalent because we're also seeing a lot of weapons in healthcare, and this whole big violence in the workplace setting is becoming a very hot issue.
Inadequate antimicrobial stewardship.
20 to, I think, up to 50% of antibiotics that are prescribed in healthcare facilities in the United States, that's hospitals and long-term care facilities, have been inappropriate or unnecessary.
Patient identification.
It's not just specific to the hospital. It can occur in the hospital, it can occur in your physician office, even in the community pharmacy. One of the problems too with that is it stays with that, it can stay with that patient for a while. If it's in the electronic record, it might be difficult to get out of that record. And it's not going to affect just one patient, you're going to affect 2 patients. Now you have another patient who doesn't even know that the wrong results or wrong test and information is in their chart.
What can our members do about this issue? Inadequate monitoring for respiratory depression in patients prescribed opioids.
There's some, easy things that can be implemented. First of all, are you screening your patients to see if they're at risk for oversedation? Patients at risk for oversedation, include those with sleep apnea. Also, patients are at increased risks for sedation, generally right post-op or, new to the medication, because you're not really sure how it's going to affect them.
Inadequate test result reporting and follow-up.
We also recommend that healthcare organizations should work to engage patients in their own health concerns by making sure that the patient understands what tests are being ordered on and when they should act upon those test results or follow up with their physician.
Inadequate management of behavioral health issues in non-behavioral health settings.
The belief is that all hospital employees should have some form of de-escalation training so that they can catch some of these early behaviors before they get to the point where security needs to come in and forcibly restrain patients unnecessarily.